Dear student, today we shall discuss another fatal and life-threatening form of pulmonary vascular disease that is known as pulmonary thromboembolism. So let us try to define pulmonary thromboembolism. Pulmonary thromboembolism is the most common and fatal form of venous thrombosis, and it is characterized by sudden blockage of pulmonary artery by thromboembolus that lead to first ischemic injury to the lung parenchyma, and it is followed by pulmonary hemorrhage and infarction. So such type of condition is almost always a dangerous and life-threatening and medical emergency, because in this situation the patient present with the feature of sudden onset of the chest pain followed by breathlessness and hemoptysis and even in the shock. So this type of clinical presentation is seen in case of pulmonary thromboembolism, which just resemble with the myocardial infarction. So there is a very important differential diagnosis of pulmonary thromboembolism to the myocardial infarction, because in both conditions there is sudden onset of the chest pain followed by breathlessness and shock hypotension. So sometimes it create a lot of problem for the clinician for to differentiate myocardial infarction and pulmonary thromboembolism, because the clinical presentation is very much similar and both are a medical emergency condition. So in the definition we were looking that pulmonary thromboembolism is due to blockage of the pulmonary artery by thromboembolism. So emboli originate from the thrombus. So thrombus is the main cause for pulmonary thromboembolism, especially the deep vein thrombosis. So it has been seen that deep vein thrombosis of lower leg vein, especially pelvic vein like popliteal vein, femoral vein, iliac vein, and iliac vein thrombosis may lead to the formation of emboli, and that emboli originate from the venous thrombus after detaching the thrombus from their original site and travel along with the circulation in the form of emboli from vein to the right side of the heart, and from the right side of the heart it enters into the pulmonary artery and go to the lung parenchyma in the pulmonary capillaries, where the diameter of the pulmonary vessel is very narrow. So here this thromboemboli lodges and causes sudden blockage or obstruction of the blood supply to the nearby tissue lung parenchyma, which undergo first ischemic hypoxic ischemic injury, then followed by pulmonary infarction. So this is the way by which the thromboembolism lead to the involve the lung and causes pulmonary thromboembolism. So main cause is thrombus formation in where kahan, especially in the deep vein of lower leg. But besides, the superficial vein of the leg also may sometime lead to the formation of thrombus, and this thrombi in the form of emboli can travel along with the circulation and lead to the development of pulmonary thromboembolism. So 95% of the cases the pulmonary thromboembolism is due to the deep vein thrombosis of lower leg. Besides this, this thrombus can originate from other side like from the cardiac origin. Sometimes the thrombi can take the form of emboli and go to the pulmonary capillaries, where it causes pulmonary thromboembolism. So let us see what are the causes of pulmonary thromboembolism. तो एक तो क्लियर है कि द ओरिजिन ऑफ पल्मोनरी थ्रोम्बोएम्बोलिज्म इज फ्रॉम द वेनस थ्रोम्बस. So all those factor, all those predisposing factor that lead to the formation of venous thrombosis, especially deep vein thrombosis, they can lead to the development of pulmonary thromboembolism. So according to the Virchow triad, all of you know that a thrombus is formed. Thrombus is what is a thrombus? Thrombus is a solid mass in the circulation formed by the normal constituent of the blood like platelet, RBC, WBC, fibrin. They are aggregated and form a solid mass in the circulation, and that is known as thrombus, or the formation is known as thrombosis. So thrombus is formed in the blood vessel by the different causes, and Virchow has given the pathogenesis or explained the formation of thrombus by three mechanisms like endothelial injury, stasis of the blood, or hypercoagulability. So in this condition, pulmonary, especially we are talking pulmonary thromboembolism, it is mainly caused by the venous stasis and hypercoagulability. Endothelial injury does not play in the venous thrombosis, especially in the pulmonary thromboembolism. It is the main cause of thrombus formation in the artery. So arterial thrombosis is mainly caused by the endothelial injury, whereas the venous thrombosis is caused by stasis of blood and hypercoagulability. So all those factors that causes stasis of the blood or increased coagulation property of the blood, that may lead to the formation of thrombus. And when the thrombus is formed in the deep vein, that can dislodge from their original site in the form of emboli, and that emboli can travel along with the circulation, enters into the right side of the heart, and from here it go to the pulmonary artery and lodges in the distant part of the lung parenchyma, where it completely obstructs the blood supply, and the nearby tissue, the lung parenchyma, suffer with ischemia followed by the infarction. So in this way the disease is going to progress. So factors like overaging, patient if remain in a buoyant position or immobilized, especially in the hip fracture or femur fracture, the patient remain on the bed for long duration, immobile, or patient suffering from the chronic debilitating condition and remain on the bed for long duration. So in this condition there may be chance of venous stasis, and that may lead to the thrombus formation, especially in the vein of the lower leg. Smoking, obesity, hypercholesteremia, hyperlipidemia, diabetes, these are the another factor to lead to formation of thrombus. Atherosclerosis, pulmonary hypertension, and cardiac disease like myocardial infarction, congestive cardiac failure, subacute bacterial endocarditis, they are the other cause of origin of thromboembolism. And sometimes in the case of hypercoagulability, like in case of prolonged use of oral contraceptive pill, in case of late pregnancy, or in the period of puerperium, overuse of the aspirin, or congenital deficiency of anticoagulant like antithrombin 3, protein C and S. So all these are associated with the hypercoagulability, and that may predispose to the formation of thrombus in the vein, and that venous thrombosis may lead to the origin of emboli, and that causes pulmonary thromboembolism. So there are many factors that play a role in the development of venous thrombosis, and when the venous thrombosis is going to form, they can cause pulmonary thromboembolism. So in all this situation, there may be chance of occurrence of pulmonary thromboembolism. Smoking is another cause. So There are many factors that may lead to the trauma. In case of disseminated cancer, in case of septic shock or hemodynamic alteration, all these may lead to the development of first thrombus formation, and that thrombus take the form of emboli, and that emboli can lead to the development of pulmonary thromboembolism. So these are the etiopathogenesis of pulmonary thromboembolism. The main changes or main problem created by the thromboembolism, it depends upon the many factor, meaning by what is the size of the thromboemboli, what is the site of origin, what is the number of thrombi or emboli. So these factors decide the pathogenesis or clinical manifestation or pathological changes in the affected part of the lung. In the lung, as you know, that lung has got dual blood supply. They are supplied by the pulmonary vein as well as bronchial artery. So the chances of infection is sometimes rare in lung, because when one artery or when one blood vessel is going to obstructed by the thromboembolism, the area is supplied by the other arteries like bronchial artery. अगर pulmonary artery में blockage हो रहा है तो ब्रोंकियल आर्टरी से कंपनसेट हो जाता है ब्लड का सप्लाई. सो द इन चांसेस ऑफ परफ्यूजन मेंटेन हो जाता है टिश्यू का, तो देयर द चांसेस ऑफ इन्फेक्शन इज रेयर इन केस ऑफ लंग बिकॉज ऑफ द डुअल ब्लड सप्लाई. So all the pathological manifestation, pathological changes that depends upon the size of the thrombus. Suppose if the size of the thrombus is large, they can easily block and completely block the bifurcation of pulmonary artery, and that is called saddle embolus, and it almost always a fatal and dangerous situation because it completely block the major artery, and that causes hypoxic ischemic injury in the lung parenchyma. But a small thrombi can go to the distant site, and here it causes occlusion of capillaries, pulmonary capillaries, and that may lead to the hypoxic ischemic injury in the lung parenchyma. It is followed by, if the blockage is not removed as soon as possible, there may be chance of hypoperfusion followed by pulmonary infarction, and that causes the clinical manifestation of pulmonary thromboembolism. So in this way, number is also important. If there are large number of the thromboemboli are formed, certainly it creates a fatal condition in more advanced stage. If you go for the microscopic examination of this thromboemboli, they are mainly appear just red and hemorrhagic in nature, and they are mainly occlusive in nature and propagating in nature, meaning by they can propagate in the direction of the blood flow, and can occlusive because they can occlude the blood supply to the nearby tissue. So they are occlusive. These microthrombi are occlusive, and they can propagate. It appear just red, blue or hemorrhagic in nature. If you go for the cut section, you will be find that this venous thrombi mainly composed of blood cells like RBC, platelet, few WBC, and fibrin is the very important component. But as compared to the arterial thrombus, in here the line of Jans is not so markable, because the line of Jans is very markable in the arterial thrombi. Pulmonary thromboembolism is mainly due to the venous thrombi. So here the lines of Jans is not so dominant. But if you go the microscopic structure, you will find that there will be aggregation of RBC, WBC, platelet, and somewhat fibrin is seen. So this is the usual microscopic finding of microthrombi or thromboemboli that lead to the development of occlusion of the blood supply, and that lead to the development of pulmonary thromboembolism. When the pulmonary thromboembolism is going to develop, it can manifest in different form. First of all, as you know the fact that it is almost always a dangerous and fatal condition. So if there is a sudden blockage of the artery, pulmonary artery, that may sometimes cause without any manifestation, there may be chance of sudden death. So that is the one major complication. Sometimes it may cause acute complication in the form of right heart failure or acute core pulmonale. Sometimes it may cause pulmonary infarction, it may cause pulmonary hypertension, it may cause pulmonary, first of all, pulmonary ischemia, infarction, hemorrhage, and sometimes pulmonary hypertension. So these are the some important complications that can be seen in case of pulmonary thromboembolism. But in all these situations, pulmonary hemorrhage, ischemic injury, hemorrhage and infarction is very clinically important, because at this situation, if the patient complains with the sudden and severe onset of the chest pain followed by the breathlessness, followed by the hypovolemic shock, and that may lead to even frank hemoptysis. So these three triad, if occurs in a sudden form, that may be a case of pulmonary thromboembolism. Sometimes this, if the emboli size is small, it can be resolved by the activation of fibrinolytic system, and that fibrinolytic system resolve the thromboemboli because of the degradation of the important component fibrin, which can be degraded by the plasmin, or that are the major component of fibrinolytic system, and that can degrade. So the in this situation, sometimes the fibrinolytic drug is very important, especially streptokinase and urokinase is given to dissolve the fibrin component and to dissolve the thromboembolism, so that the circulation is maintained. But sometimes this microthrombi or thromboemboli can organize in the blood vessel wall. So blood vessel wall undergo pulmonary arteriosclerosis, and that may lead to the development of pulmonary hypertension. As you know that the pulmonary infarction is another complaint, and hemorrhage is another complaint in case of pulmonary thromboembolism. So infarction is slightly rare. क्यों रेयर होता है? Because of dual blood supply. If one is blocked and this is compensated by the other competent artery, so infarction का चांस कम होता है, लेकिन होता है. तो that may has got a very characteristic gross appearance. The shape is wedge shaped and the size is variable. Site जो infarction का होता है, characteristically it involves the lower lobe of the lung. It appears grossly red and hemorrhagic, and sometimes the adjacent pleura is also going to involve in the form of fibrinous pleuritis. So that may lead to the occurrence of chest pain. So the affected part in the lung parenchyma, which undergo the infarction because of the sudden blockage of the artery by the thromboemboli, they appears red, hemorrhagic, variable in size, wedge-shaped, and seen especially in the lower part of the lung. So this is the gross appearance. If you go for the microscopic examination of that site, the lung is actually congested, the lung parenchyma is congested, edematous, it appears hemorrhagic red, and there will be infiltration because there is a ischemic injury start. So inflammatory reaction, as well as there will be cellular changes in the form of infiltration of neutrophils will be seen at the site. Since there is a chance of hemorrhage, so there is hemolysis, RBC can be hemolyzed, and that there may be chance of hemosiderin pigment can be seen, and if it is heals, healing process may lead to the granulation tissue formation at the site of lesion in case of pulmonary infarction. Sometimes pulmonary infarction may lead to the formation followed by the bacterial infection, and that may lead to the cavity formation even. And this infarction is a very last outcome of pulmonary thromboembolism. So this is something about the pulmonary thromboembolism. Again, I told you that it is a life-threatening condition because almost always the patient present in the medical emergency in the form of sudden and severe chest pain followed by the breathlessness and hemoptysis. This three triad is very important for the different differential diagnosis from the myocardial infarction. Even in case of tension pneumothorax, sometimes this such type of presentation is seen. But hemoptysis is the very differentiating point. In case of myocardial infarction, hemoptysis is not occurring, but in case of pulmonary thromboembolism, hemoptysis is a usual finding. So this is the cause is thrombus formation, venous thrombus, and venous thrombus कहाँ का vein, especially deep vein कहाँ, from the lower leg कौन सा vein, popliteal vein, iliac vein, pelvic vein. These are the vein that is the site of origin, source of origin of thromboembolism. So the vein is the main site, but superficial vein can also be involved. And what are the predisposing factors for the venous thrombosis? You know, the stasis of the blood as well as hypercoagulability. So those factors which are associated with sometime in case of puparium or sometime in the some followed by the delivery, there may be chance of uterine involvement. In case of male, sometime prostate venous complex may be the site of thrombus formation. Some in the female uterine vein is the site of thrombus. So in case of puparium or in some time following after the delivery, there may be chance of pulmonary thromboembolism. So this is the usual predisposing factor where the thrombus is going to form, and when the thrombus is formed, thrombus can propagate, can detach, can travel in the along with the circulation in the form of thrombi, in the form of emboli, and that emboli can lodge to the different site where it may lead to the development of